Multiple traction band assisted endoscopic submucosal dissection of giant colorectal lipoma after unsuccessful unroofing. We have nothing to disclose. The equipments used are shown in the table. Background. Large lipomas can cause abdominal symptoms such as abdominal pain, bleeding, and intussusception. Due to high risk of adverse events, surgical resection has been the mainstay of treatment for large lipomas. Case. A 50-year-old female with a history of open surgery for infantile intussusception underwent colonoscopy due to recurrent intermittent lower right abdominal pain. Colonoscopy and abdominal CT scan was performed, leading to a diagnosis of colorectal lipoma. 50-year-old female underwent colonoscopy, revealing a 70 mm soft reddish submucosal tumor in the ascending colon. Unroofing was initially attempted, but due to the poor electrical conductivity of the fat tissue, snering could not cut through the lipoma. Multiple small resections of the mucosa were performed until spontaneous protrusion of the yellow fat tissue was observed. Two months later, 50 mm lipoma persisted, prompting resection. Two elastic traction devices were clipped onto the colorectal wall on the countergravity side. The other end of each band was clipped onto the lipoma. The pulling force of the traction bands lifted the lipoma away from the muscle layer, allowing clear view of the base. Following submucosal injection, mucosal incision was made from the proximal side of the lesion. Another traction band was applied to the dissected mucosa, such that the dissected lesion was lifted to open the dissection plane. As the dissection proceeded, additional traction devices were applied appropriately to continuously pull the lipoma away from the muscle layer and maintain a clear view of the submucosal layer. Following total resection of the lipoma, the defect was closed using clips technique, a closure method that approximates a defect using conventional clips and a line, which is finally secured using an endoloop. The specimen was collected using a net retriever. Histological analysis confirmed a benign lipoma. At 1-year follow-up, the patient remained asymptomatic with no endoscopic sign of recurrence. This is a schematic image of the strategy used in this technique. Conclusions. Unroofing can be unsuccessful in large colorectal lipomas, as was seen in this case. Using multiple tractions can facilitate endoscopic resection of large ileal lipomas.